Recognizing Cowichan Valley.
Thank you, Madam Speaker, and it gives me pleasure to join with my colleagues from both government and official opposition to speak in support of the motion, be it resolved that this House affirm its opposition to the practice of conversion therapy for lesbian, gay, bisexual, questioning, transgender, queer, two-spirited, intersex, or any other minor. As pointed out by my colleague from the official opposition, conversion therapy is the pseudoscientific practice of trying to change an individual's sexual orientation from homosexual or bisexual to heterosexual using psychological or spiritual interventions. There is no reliable evidence that sexual orientation or gender identity can be changed, and medical bodies overwhelmingly condemn the practice, warning that conversion therapy practices are ineffective and can be seriously harmful. Attempting to force somebody to change their sexual orientation or gender identity, an integral part of who they are, is associated with trauma, increased rates of suicide, and significant impacts on people's mental health. While it is believed this practice is thankfully uncommon in British Columbia, there have been advertised sessions in the past few years that these types of, quote, treatments may still occur behind closed doors. Our staff have spoken with people whose lives have been deeply impacted by this, and the stories are heartbreaking. I stand here today with people around the province resolute that it is time for our province to take action to protect people from this harmful practice, determined to bring us in line with many other Canadian provinces who have shown leadership on this human rights issue. Manitoba has partnered with seniors and active living, regional health authorities, health profession regulatory colleges, and Manitoba Health to ensure that conversion therapy has no place in their healthcare system. Ontario passed a landmark law banning conversion therapy on lesbian, gay, bisexual, and transgender children and preventing medical practitioners from billing OHIP for it. The leader of Nova Scotia's Progressive Conservative Party called for members of the House of Assembly to come together and ban conversion therapy for youth in the province. Each party tabled their version of a conversion therapy ban and worked collaboratively to pass one unanimously in September. This month, the Canadian Bar Association sent a letter to the federal government calling for them to impose a specific ban on conversion therapy. The federal government has also received a petition asking for them to take action on conversion therapy, and while they condemned the practice, they declined to take action, stating it was the responsibility of the provinces to address. So let us address it, Madam Speaker. Let us join our fellow provinces and other countries and states that have taken action against this abhorrent practice. Let us live up to our claims of valuing diversity and inclusion. Let us protect our children by standing up for them and saying we accept them for who they are and who they were meant to be. Every person deserves to be part of our community without fear of discrimination, harassment, or violence. It is the responsibility of leaders in our community to ensure that we provide a safe, inclusive, and welcoming environment for all members of the community, including those who identify or are perceived to be LGBTQ+. The work of addressing stigma, bias, and discrimination against people who are marginalized because of their sexual orientation or gender identity is ongoing. We must continue to be vigilant against those who promote hatred and try to turn back the clock on the progress we have made as a community. Over the last many months, my office has been consulting with leaders in the LGBTQ2+ community and people who have suffered conversion therapy while working on a bill with legislative drafters to ban the practice in British Columbia. Notice of our bill will be tabled this afternoon, and the full private member's bill will be put out before the House by the end of this month. Following the leadership and spirit of collaboration shown in Nova Scotia, I thank the government for initiating this important motion and for the opposition for supporting it, and invite both the BC NDP and the BC Liberals to support our bill or bring one forward of their own proposal. Conversion therapy forced on youth is child abuse. It is not welcome in our province. Let us stand together to show LGBTQ2+ British Columbians that they are accepted, they are valued, they are loved, and they are safe. Thank you.